Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Ciclopirox. Brand name is Loprox. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, in this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Ciclopirox. We'll then touch on examples of dosing, and then finish it off with side effects. I've put together some slides to go over this information, so let's jump right into it. So the first thing to discuss here will be the mechanism of action, or how this medication works. So Ciclopirox has a mechanism of action that is not completely understood. However, we do know that it may inhibit transport of certain essential substrates into fungal cells. It may also interfere with synthesis of proteins, RNA, and DNA in growing fungal cells. And high concentrations of Ciclopirox may alter cell permeability and osmotic fragility. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used in the treatment of mild to moderate onychomycosis of the fingernail or toenail. This would be a fungal infection of the nail. It may also be used for seborrheic dermatitis of the scalp, as well as superficial tinea. Tinea is the name of a group of diseases caused by a fungus. With respect to contraindications or reasons we would not be able to prescribe Ciclopirox, well, there's actually no determined contraindications for this medication, which is good news. Now for some examples of dosing, so in the treatment of onychomycosis of the fingernail or toenail, you would usually apply the nail liqueur 8% solution once daily to affected nails with the applicator brush. Preferably, you would use this at bedtime with 8 hours left before washing. You would remove with alcohol every 7 days. In the treatment of superficial tinea, you would give a gentle massage of the 0.77% gel topically to the affected areas and surrounding skin twice daily in the morning and evening, immediately after cleaning or washing the areas to be treated for 4 weeks. As with all medications, there are some side effects or adverse reactions that patients may experience while using Ciclopirox, so I'll go over some of those here now. Some patients may experience an application site reaction when they're using the shampoo. Other patients may experience a burning sensation. Erythema or redness may happen around the nail, as well as pruritus or itchiness. Alright everybody, that's all we're going to talk about today with Ciclopirox or Loprox. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, and most importantly subscribe to the YouTube channel. And there's also some links in the description you can check out as well. So for today, take care.